Well, May is Skin Cancer Awareness Month. It serves as a reminder to get your skin checked and to wear your sunscreen.
Joining us to keep the sun fun is board-certified dermatologist Dr. Aderonke Obayomi. Welcome to New York Living. Thank you for being here.
Hello. Thank you for having me.
How's it going?
Very good.
All right, so this is. I was saying we were talking in the break. This is a constant form of anxiety, a constant cause of anxiety, because it's like, you know, the UV rays are getting stronger. Melanoma is more common, or more kind of what's it called, diagnosed. Mm-hmm. So self-diagnosis is very hard. Go to a professional, and I think that's the best kind of way to do it, right?
Of course. So I recommend to everyone they should do an annual skin cancer screening. So everyone should do one at least once a year. If you are someone who has higher risk, like you have a lot of different spots, like you were just telling me, or if it runs in your family, those are certainly, you know, reasons to maybe go and see someone sooner. But also, people should be doing regular self-examinations at home. So just be aware, if you see anything that's changing, that's always a good time to go see a board-certified dermatologist.
And you know, in New York, this last couple of days, yesterday and this weekend, is going to be cloudy. It's going to be, you know, not sunny, and many people don't wear sunscreen. Now, the question is, do we still need to wear sunscreen on cloudy days?
100%, yes. Sunscreen should be worn year-round, regardless if it is raining, it is snowing, it is bright and sunny outside. The sun is always with us. So you want to make sure that you wear sunscreen every day wherever is exposed. So at minimum, that should at least be your face and your hands on a daily basis.
How do we determine what number of sunscreen? Because I use a 900. Like I'm just using like a suit of armor. I think at this point. So how do you determine which number is appropriate for you?
So I always recommend SPF 30 and higher. Okay. SPF 30 is what we're looking for, and you want a sunscreen that is broad spectrum, meaning that it's both UVA and UVB protection. But as long as it's 30 or higher, I am happy.
But UVA and what is it?
UVA.
UVA and UVB. And that says it on the bottle. You should look for that.
Now, melanoma is on the rise, and you want to clear up some myths. Are people with darker skin tones at risk or have higher risk
of melanoma? So everyone, regardless of your skin tone, anyone can get skin cancer, anybody can get melanoma, okay? So usually people tend to think about skin cancer or melanoma as being something that only happens to lighter skinned people, but just last week I had a patient who had melanoma on her toe that I diagnosed, on her bottom of her foot. And this was a black woman, so you know, it can happen to really anyone, but typically in skin of color, sometimes it can happen in areas that aren't as so sun exposed. So you want to be able to look at places like your fingernails, your palms, and your bottom of your feet. These are places that melanoma can show up in skin of color, and it's something that a lot of people are not aware of. So even though, you know, maybe you don't think about it so much, everyone should be able to go see a dermatologist and make sure you look at some of those spots that are not as commonly thought of as the sun-exposed areas.
That is interesting, because people think, oh, my nose is. I mean, that's obviously a common place, but like it is, like it's places that would be covered. They can still be affected. That's interesting.
Yeah, so the skin cancer, so, you know, there are many different types of skin cancer, squamous cell, basal cell, melanoma being kind of the most common ones, but they can affect anyone regardless of your skin tone. Melanoma being the one that people talk about the most because it can be the most deadly one, but it can really affect anybody.
Let's talk about the diagnosis gap, because we know Black and Hispanics get diagnosed much more later. Why is that?
I think there's a lack of awareness. So, you know, a lot of skin of color patients will think that they cannot get skin cancer. And so maybe they see something that's changing, or maybe they don't see it because it's in some of these areas that are a little bit more hidden, whether in their genital area or in the bottom of their feet. So they're not looking. Or maybe they go to other doctors and they're not quite as aware about it. So by the time that they see something is happening and they go see someone, oftentimes these things are much later in, you know, much further along, which is, you know, is unfortunate, because oftentimes if skin cancer is detected earlier, the outcomes and, you know, the treatability are much better.
And there's an ABCs to like kind of looking at your own body. There's different like shapes and things you can, like, what are those? So
for the ABCDs of melanoma, this is for any spot that you may have. So A is for asymmetrical. So ideally any spot you have, we'd like it to be that we could fold them over and they'd be the same on both sides. B is for borders. We like things that have nice, smooth, round borders. C is for color. So if anything is changing colors, has multiple colors within it, we don't like that. D is for diameter. So we like things to be about no bigger than an eraser on a pencil. And then E is for evolving. So just anything that is changing, growing, bleeding, or itching. These are all reasons for you to come and see me or any board-certified dermatologist sooner. And then personally, I like to think about F for funny looking.
Oh, interesting.
They're all funny looking.
Yeah.
And like some people, they take pictures of a mole and then they kind of they take another like a year later and just kind of reference to see if it's changing. So that's a good way to kind of document it, right?
Absolutely. But sometimes, you know, in my clinic, I have a little scope that I use, and you can get a really close-up photo. So,
Right.
you know, it's good to take with just your phone.
Go to
But
a
if
doctor.
you want the really close-up, really,
Yeah.
you know, expert opinion, then you should go to a doctor.
Did you bring the scope today?
I did not bring it. I'm sorry.
I
I thought
need
about
it.
it.
I need this.
He was going
You're-
to ask you to do it.
Every day I'm like, what's
TV.
this?
You're
What it
gonna
looks
come
like, I don't
see
know.
me.
Yeah.
You gotta go.
I'll come see you.
Yes,
I'll come see
there
you.
you
Thank you
go.
very much, doctor. Appreciate it.
Pleasure to be here. Thank you.
Very, very cool. Thank you for your information.